Hi everyone, and welcome to I Jump Instead. My name is Stephanie, and I am a fitness instructor here on this YouTube channel, I Jump Instead. I jump on a rebounder, a Cellerciser rebounder, and I instruct wonderful routines on this channel. And if you are here for my PPPD story, I'm gonna let you know that I encourage jumping as a sport, as a fitness program. It's definitely suited me on all levels, and I am using it as part of my therapy. But the point is that it's so fun. It's very powerful. If you get a high quality rebounder, just like with any fitness equipment, you don't want to get the cheapest thing out there. You want to get a high quality rebounder. So if you'd like to jump instead with us, definitely check out our channel here. We've got lots of videos and we do lots of routines, and I'm one of your instructors, and I can relate to you because we have something in common, and that is triple PD or a vestibular disorder of any type. And I hope I can help each and every one of you watching this, because I have come so far in my journey. I am healing quickly at this point, and it all has been happening very recently. This healing process has been happening recently. I have actually been experiencing this for 5 years, but right now I'm on the cutting edge of basically overcoming completely my symptoms. So for those of you who don't know what triple PD is, it's persistent postural-perceptual dizziness. And Google defines it as a syndrome of subjective imbalance or chronic nonvertiginous dizziness accompanied by hypersensitivity to motion stimuli and poor tolerance for complex visual stimuli or precision visual tasks, but without identifiable vestibular impairments. The continual subjective imbalance or non-vertiginous dizziness persisting for 3 months or longer is the core physical symptom of this disease. Patients with triple PD often describe the dizziness as swaying or rocking when standing or sitting. Although PPPD has been widely accepted by American clinicians, it is currently not well understood by domestic clinicians. This is November 2022. I hope that it's more widely known, and more doctors and more nurses and more physical therapists are aware of this condition and can help to get the healing process started, because it is curable and it is definitely something that we can train the brain to reverse. And I'll tell you exactly how I did that as well later in the video. But I'm going to start from the beginning. When I first began my PPPD journey, and it was the beginning of 2018, I was doing a spinning exercise. I had just embarked on this spinning exercise. It was about day 10. I put my arms out to the side and I do a spin, and I do maybe 3 for the first week, 5 for the second week, 7 for the next week. And I was up to 8 or 9 or 10 spins by the end of the week. And shame on me, because I went too hard too fast, and we all do that sometimes, right? So I noticed that on day 10 of doing those spinning exercises, only once in the morning, in the afternoon time, I was in the kitchen, I started feeling like this dizziness in and out. And I was like, interesting, I don't know why that's happening. And then I was like, okay, putting 2 and 2 together, I am so done with spinning in the morning. Like, I stopped immediately. And I think it was within like the next day or 2, I had my first panic attack. Now, some people I've looked up on YouTube and I've watched their PPPD stories, and they believe that their initial onset event for creating or causing the PPPD was a panic attack. And this very well may have been my story, but I don't know for sure. I was doing these spinning exercises at the same time, and the dizziness and the spinning, it seems so uncanny. It seems like it had to have been part of this vestibular event that I experienced. But I had also had my first panic attack. Maybe the spinning caused the panic attack. It wasn't at the very same moment, but it was later the next day after I stopped the spinning exercises. And I'm recalling all of this experience as best as I can, but this is close to it. So I had my first panic attack, and then I remember just having afternoon, it was only really in the afternoon, I would just be in the kitchen, I would notice this dizziness, in and out. And I remember over the next few weeks, I remember the symptoms, like there was days when I didn't have any symptoms, and then there was days where I had some of this dizziness in the afternoon. And so I was not really concerned about it. I could only just notice if it was getting worse, staying the same, or getting better. And I felt like it kept getting better. And then it would just kind of, show up again and back and forth. And so I thought maybe it was like BPPV, which is basically, it's like a rock in the eardrum that becomes loose, where it can be fixed, and it can, even just by doing a certain physical therapy movement at home or in an office, it can be fixed. Usually the symptom of BPPV is, and look it up, I'll put the definition of that. Usually that is vertigo, which I never experienced vertigo. I experienced just the dizziness. So about 2 years in, I noticed that I was getting a lot of anxiety and a lot of dizziness. For me, the dizziness and anxiety went hand in hand. It was like chicken or the egg. Which one came first? Was all this dizziness? My brain was just, so what was happening was that my brain was firing neural pathways, or, it was messaging and basically responding to my thoughts or my energy, maybe the tension in my body. It was responding automatically as a fight or flight, and it was causing the dizziness instantly. The dizziness and anxiety were causing each other, and they were kind of just firing back and forth. And there would be times in the year where the anxiety I wasn't as anxious, and so the dizziness was low, but it was like I didn't always have to have high anxiety with the dizziness, if that makes sense. So like I did choose in 2020 to treat it with an SSRI drug, and that was sertraline. And I'd never been on a drug like that before. And I noticed within probably 2 weeks, my symptoms started just to resolve and go almost completely away. And I was very happy about that. But I wasn't really happy about having to take an antidepressant, because I knew that ultimately wasn't a cure. And that was like the first thing I said was, I want a cure. I don't want a Band-Aid. I want a cure. Like, this was like me telling my doctor and my physical therapist and everything. But I did try it, and I remember trying it for 3 months, and I remember feeling so good that I wanted to quit the medication. And I remember probably for the next 3 to 6 months, I had maybe 10% of my symptoms showing up, the dizziness symptoms showing up post medication. And to me, that was tolerable. To me, that I could cope very easily with that. And then it was like 1 year later from the 2020 experience, 1 year later, almost to the month, or, it was to the month, I noticed that the symptoms were coming back very strongly, like a lot of anxiety and a lot of, a few panic attacks. So I can't count how many panic attacks I've had since my very first one, but it may be like 10, maybe 15, depending on what I would consider to be a full-blown panic attack. But it was mostly just, for me, it was shortness of breath and heart palpitations, and kind of just not really sensing like reality in the same way, and just not feeling quite right. But, in a very, everything is wrong, nothing is right. It's like, that was my experience. Everybody has a different panic attack experience. So 1 year later, I decided to take the pill again, because the anxiety was so bad and the dizziness was so bad. And I took it again for about 3 months. This was in 2021. And I felt 2 to 3 months. And I was like, I feel so good. That's like rule number 1. Don't quit antidepressants, but this would be for like a psychiatric disorder, like, if this was something underlying, where if I'm actually treating the depression or anxiety, like that would be like don't quit your anti-anxiety medication, stay on it, even because you feel so good, there's no more anxiety, you feel so good, don't just quit it. But in my circumstance, I didn't feel I was treating anxiety, I felt I was treating dizziness, and I really wanted to make sure like I wasn't masking this dizziness, and I was needing to really come to the root of the cause. And so when I was on the medication the second time, I remember that my dizziness was more prevalent than the first time I was on the medication. So the first time I was on the medication, I feel like my symptoms were like 99% gone. And then the second time I was on the medication, I felt like my symptoms were like 85% gone. And so now, and then afterward, I noticed, yeah, I'm still having these symptoms most days, most every day, but I'm not letting it myself get down, you know, just doing my best to cope with it. So fast forward to really recently, it is November 2022. And just last month, this is the third year in a row that I just got this really a lot of anxiety, all of a sudden panic attacks, a lot of dizziness associated with this, a lot. Intermittent. The symptoms are never all day. They never have been, but they're just so persistent. It would be like the reason why I felt compelled to take this pill the third time in a row was because I had an experience where normally the symptoms were kind of just intermittent, like I was saying, but this time around, this third time around, they were not kind of nonstop. Like I'd wake up with them, and versus where before it would be like the symptoms would kind of start to show up more like after a few hours after I woke up. So I actually had an adverse reaction to the medication this time around, this third time around. I noticed that I did start to feel better. I did start to have less dizziness throughout the day instantly. But since the very first day I took this medication, in the nighttime, I had a panic attack. And then 10 days in a row, I had not panic attacks in the night, but I had panic in the night, where I would just be like onset panic attack every night for 10 days while I started taking the pills for the third time in a row. So I had an adverse reaction. I quit it. I stopped, and I finally came across the answer, finally the wisdom that I needed. If, you know, whether this is my cure for me, that is to be determined, but I can tell you right now, everything has changed. It is 100% changed. So I found this wonderful woman who calls herself an expert on vestibular disorders such as tinnitus and vertigo. And her name is Joey Remini. I'm going to put her name up. I hope that's how you pronounce her last name. She has a book called Rock Steady. She has a program called Rock Steady. And it is really an approach through neuroplasticity. The idea behind neuroplasticity is to first become aware of what is happening, that we are responding with a fight or flight. It's just an automatic response. That is kind of something we can't control, just the fact that it's an automatic response. And with neuroplasticity and becoming aware of this automatic response of kind of being in this chronic like fight or flight response, first we become aware of it, and then she is the expert, and she helps to train us into becoming our own experts, our own masters at rewiring the brain. The book is like $15 on Audible, $12 to $15. It's available on Amazon. It's available on Audible, and those are the two sort resources I know about, but I got it on Audible, and I'm listening, and I am not even halfway through that book, and I am like healed. I'm like halfway healed. So I'm going to explain how I feel I am healing. So she is amazing, and she describes, what is going on exactly with the, the brain, and how this is really just a matter of rewiring and understanding what is really happening, because, the first step to healing anything is to become aware, and acknowledge it and own it and accept it, really, really accept it and be okay with it. And that is really the essence of the healing here, is being okay with the symptoms. So when I reached out and I watched other people that had this disorder and they've healed from it in their own unique ways, or whether they've healed from it or not, one thing that stood out to me was whether or not they had symptoms remaining or not. I used to have one mission and one mission only, and that is that I will not accept any sort of treatment that has me dizzy for life. I don't want to cope with dizziness for life. This is how I've been perceiving PPPD up until now. And I still now feel very strongly about not wanting to experience symptoms. I don't want to keep experiencing dizziness. Her methods are 100% healing my symptoms. The total amount of symptoms throughout my day are reducing significantly by the day. And I couldn't be happier because my relationship with my symptoms has changed completely. And that was the nature of healing my symptoms. That was the nature of starting to reverse the symptoms completely. So this is how I put it. When the dizziness happens, the response is anxiety. And so when the anxiety happens, the response is the dizziness. And they just keep ricocheting off each other back and forth, and they just don't stop ricocheting off each other. And that has been me for the last 5 years. And what she teaches you to do is take the symptom, whether it be dizziness, even vertigo, tinnitus, or any sort of vestibular disorder. All we have to do is we have to remove the anxiety response from the symptom, whether it be dizziness or whatever. So how do we get our bodies, how do we get our brains, our minds, our hearts to respond to the dizziness in a new way? And it's very basic. It's basically just saying, allow the dizziness to happen. Feel it. Be okay with feeling it. So maybe when I was taking the medications, the antidepressants, I was saying, I'm not willing to feel the dizziness. I don't want the symptom of dizziness. I am not willing to experience the symptom of dizziness. And that is resisting. And it is resisting my what is reality for me, which is I have PPPD at this moment, at this time in my life. And the reality is that I need to face that reality. I need to face the dizziness. So she taught me to start to calm my response to the dizziness. So she just basically says, we just learn to accept. It's like when we feel the symptom of dizziness, we actually have to say, okay, I'm noticing dizziness. Okay, I'm accepting it. It's like, no big deal. And when that was my new reaction to the dizziness, I noticed that I started practicing that response. I started practicing the accepting. It was literally within a matter of a day or two, or even just a matter of minutes, that my relationship with the dizziness changed. It just switched. And I noticed that the dizziness, I was starting to, this anxiety that, was the trigger, it was the ricochet. This anxiety started to dissolve. I started to eliminate the anxiety and instead replaced it with peace. Let's do this for peace. The dizziness can't feed anymore. So that means the dizziness starts to say, okay, I'm done with that. I don't care about peace. I ain't got no time for peace. I got time for anxiety. I got time for fear, for panic, for reaction, for priority. Like what this does, what the anxiety does, is it just simply causes the brain to make the dizziness a priority. It's like if this were to be the bad guy and this is the fear, your brain's doing what it should be doing. If the fear is the response to the bad guy, that's good. That's a good thing. The bad guy is dangerous. We want to get the heck away from the bad guy. So the fear is a good response. And so these two go hand in hand. But if the dizziness comes in and we just eliminate that fear, that anxiety, and we just start to just observe and being more of an observer and a witness, automatically the symptoms start to reduce and go down and down and down. This is the only other thing I'm going to say about it because, I want you to get on with your day and I want you to get on with starting to practice this, put this into practice. So another technique she has is body scans where you lay down, sit or stand, and laying down right before bed or laying down right when I'm waking up those are ideal times to do this. So all she has you do is a body scan where you just pay attention to your feet and you scan your body all the way up to your head or whatever. You can do it however you want. If you want to go up one leg, down the other, if you want to go left to right, top to bottom, it doesn't matter. But what you're doing is you're spending time feeling and paying attention to your body. This is a form of meditation. And there's like so many people out there that say meditation works. Why? Because we are spending time doing something. Let's say we start a new job and we spend time at our new job. And day 1 and day 2 and day 3, day 4 goes by. When you go to your job on day 5, you can't erase what you've learned, what you have absorbed. You're a new person now. Now that you're in your job, your new job, and you've had 5 days of experience, you are officially trained. Okay? So when you start to spend time feeling, it literally is all it takes is to spend intentional time of feeling your body. That is all that is required. It is naturally going to take over the brain that you had before you started your job, where there was no memories, there was no time or experience in the job. So now that you have taken the 5 minutes, the 10 minutes to lay down or sit or stand and just pay attention, feel your body go, from muscle to limb to knee to, you're supposed to feel the clothing, feel the touch, feel. Spend time, just minutes at a time, whatever, as long as you want. The more time, the better. But the more time we intentionally spend, all of a sudden, as the days go on, we notice that our brain is just recalling that time. We start to pay more attention to feeling good. And what we want to do is have no judgments. I didn't say that before. But when we're body scanning, we're not judging negatively. So we're just having peaceful feelings, safety feelings, pleasant feelings. If you're just sitting there, lying there, whatever, and you're just having full-on symptoms in that moment, that's a good opportunity to practice feeling safe. You're lying down, for goodness sakes. You're not going to fall. You're as safe as can be. So just pay attention to your own ability to feel safe. Do you even feel safe at all? Like it's time that you do start to feel safe if you don't. And spending time feeling safe while you are standing, sitting, lying, and feeling your body, that is going to take over. And you're going to notice that throughout the day as your symptoms show up and you notice that you have a peaceful response to it, you're just going to keep changing your relationship with the symptoms. And then pretty soon you are going to be me now, which is, I'm no longer the person that says I refuse to have symptoms, because guess what? My symptoms don't suck anymore. My symptoms are fine. My symptoms, I don't have an issue with them anymore. And the reason why I don't have an issue with them anymore is because deep down inside, I know that they've already significantly reduced in quantity. So I'm like, now why would I even react to symptoms anymore? Because now that they're only happening like 30% of the time, symptoms never last all day long. They only last for a short period of time, usually. And we don't even notice that they go away. We notice that we have a symptom and we're like, crap, I'm dizzy right now. Then 30 minutes later, we're like, okay, I don't even know when I stopped being dizzy, but I did. The feeling, the body scanning, and the new reaction to our symptoms being peaceful and feeling safe. And it is only a matter of time before the symptoms just start to eliminate and start to go away. And then the less symptoms we have, how can we have a problem? How can we have an issue with that? Now, I expect that the next time I make a video, I'm going to say, I've officially eliminated my symptoms. I don't expect these symptoms to last very long because I'm becoming a master at just like, it's almost like I'm dodging the symptoms because the peace just shows up. The peace, acceptance. So I'm having acceptance of the symptoms. I'm still experiencing the symptoms. I'm loving the symptoms. I'm enjoying them. I get to sway and rock and have these comforting feelings toward them. And then I can all of a sudden notice I have so much more awareness. Just in general, I have so much more awareness in life. I'm just more present. And I can notice that, my symptoms are not lasting all day long. And it's just, this is great. So I can't wait to share again, and I'm looking forward to my journey and my personal experience with this, and I hope I've helped somebody watching. And I strongly recommend buying the book Rock Steady on Amazon or definitely listening to the audio, and I like to re-listen. I love what she says. I love the narrator, the lady who reads the book to me. She's wonderful. And it has been a eye-opening, mind-changing experience, and I am becoming a whole new woman. And I'm so happy that I finally gave the drug-free approach a shot, and finally healing and finally feeling so much better about my symptoms and feeling so much better in general. The symptoms are dissolving and are about to be gone completely. And even if they did show up in the long term, I could care less. Thanks for listening, and I'll be in touch. I'll keep you posted. I hope you have a great rest of your day, and stay peaceful and do what you gotta do. And if you are gonna start jumping instead with me and with my sister Sally, I definitely encourage that you get a high quality rebounder, a Cellerciser rebounder. It's a tight mat that never stretches, and the springs don't stretch either, which are so important. The mat and the springs cannot stretch. If you want to get a tight body and you want to get nice muscle density throughout your entire body, and the handlebar we highly recommend, and it's a very high quality rebounder. And you can jump instead in your home. You can get many different types of results. If you want to just do cardio, you can do that. Well, good luck with that, because you're going to get muscle regardless. You're going to build muscle density. Landing on a tight resistance mat is inevitable, but you can also get really jacked and shredded and ripped if you wanted to. It's up to you, but definitely join the 10 minutes a day community here in I Jump Instead and in our I Jump Instead Facebook group. And we also share what we eat, and we do that on our Trophy Body Diet Instagram account. And we also have I Jump Instead on Instagram as well. Thanks so much for watching. I'm going to put all the links I can in the description below, and take care, and I'll see you in the next one. Bye-bye.